So what is the consensus point 2? How early can we start ARNI in acute decompensated heart failure? Whether we should start pre-discharge or at first follow-up, and what precautions should we take when we are initiating ARNI in our hospitalized patient? So to answer all these questions, there were few trials which were conducted, and the most important trial is this pioneer heart failure trial, where ARNI was compared to enalapril in hospital patients. I mean, ARNI was started in hospitalized patients before discharge. So how this trial was conducted? First, the heart failure with reduced ejection fraction patients who were presented, who were admitted with ADHF, they were stabilized. The blood pressure was stabilized. I mean, no more increase in IV diuretic was required. And finally, they were randomized to two arms. First arm were supposed to get ARNI. The target dose was 200 twice daily, and the second arm was supposed to get enalapril with a target dose of 10 milligram twice daily. So what outcomes were evaluated? The NT-proBNP levels at the end of the trial, the safety and tolerability of ARNI, and the clinical outcome. Of course, we get signals of clinical outcome here, but as such, this trial was not powered enough to have very significant information in terms of clinical outcome with ARNI versus enalapril. So what changes we see here in terms of NT-proBNP and cardiovascular death or hospitalization for heart failure? So this graph shows that among patients with heart failure reduced fraction hospitalized for ADHF, the in-hospital initiation of sacubitril valsartan led to a greater decrease in NT-proBNP as well as improved clinical outcome compared to enalapril. Here we can see that there is very early separation of the curve. I mean, very early benefit seen with sacubitril valsartan. See here, there in the left side of the screen, we see the graph which depicts very significant reduction in NT-proBNP within 8 weeks of randomization, and as well there is significant reduction in cardiovascular death or hospitalization within 8 weeks of randomization. P-value seen in both the cases, it is very significant.